Today, we will discuss the most common gynecological instruments.
In this video, we shall explore an important set of gynecological miscellaneous instruments, their identifying features, major uses, and surgical importance in operations like DandC, hysterectomy, myomectomy, and obstetric care.
Green Armytage Forceps.
This forceps has triangular blades with serrated edges, and even when fully closed, a small space remains between the blades. It is mainly used as a hemostat to reduce bleeding from the cut edges of the uterine incision, especially during caesarean section. It can also serve as a retractor during gynecological or obstetric procedures.
Ovum Forceps.
This instrument has cupped blades with linear fenestrations designed to hold tissue gently but firmly. It is used for removing the products of conception in cases of incomplete or inevitable abortion. It is also used for clearing retained membranes from the uterus after delivery. It is also used for removing any foreign body from the uterine cavity.
Broad Ligament Forceps.
These are strong forceps with long blades that may be straight or curved. They have transverse or oblique serrations for a secure grip. They are used to clamp the broad ligament during hysterectomy. They are also used to retract the uterus and to grasp pedicles of cyst, fibroids, or fallopian tubes in ectopic pregnancy.
Bozeman Catheter.
This is double channel instrument. The outer tube has large holes while the inner tube allows irrigation fluid to pass through. It is used to wash out uterine contents during procedures like dilation and curettage. It is also used for giving hot douches to stimulate uterine contraction in postpartum hemorrhage cases.
Uterine Packing Forceps.
This is an S-shaped forceps curved according to the natural axis of the birth canal. It is used for packing the uterus when bleeding cannot be controlled by routine measures during DandC, dilation and curettage. It is also used for sterilizing the cervix and vagina with antiseptic solutions, especially in cases of procedentia, that is, prolapse of the organ from normal anatomy, especially uterine prolapse.
Myoma Screw.
Myoma Screw is a metallic screw-like instrument used during myomectomy procedures. It is screwed directly into the fibroid mass to provide a firm grip, which helps in traction, manipulation, and removal of the fibroid tumor from the uterus.
Bonney's Myomectomy Clamp.
Bonney clamp is used during fibroid removal surgery to hold the uterine artery and round ligament near the level of the internal os. This helps control bleeding and prevents the uterus from falling posteriorly during the surgery. The blades are often covered with rubber tubing to prevent trauma to vessels and surrounding tissues.
Bladder Retractor.
This is a right-angled retractor used after opening the peritoneum in vaginal operations. The purpose of use is to retract the bladder away from the surgical field, particularly during hysterectomy or interior vaginal wall repair, to avoid accidental injury.
Vant's Uterine Polyp Forceps.
This instrument is designed for removal of cervical or uterine polyps. Polyps visible on speculum examination are held and twisted 2 to 3 times using this forceps until they are avulsed completely from their stalk. It is a simple yet essential tool for minor gynecological procedures.
Allis Forceps.
Allis Forceps have long handles, short toothed blades, and a locking mechanism for a secure hold. They are used to approximate edges of skin and peritoneum during suturing. The most common uses of Allis Forceps includes holding the skin edges while suturing, holding the peritoneum or rectus sheath during closure, grasping the ovary during surgery, holding uterine tubes during tubal ligation, and for holding the interior lip of the cervix if a vorcellum is not available. Then we go with Allis Forceps. Allis Forceps are a versatile and essential tool in almost all gynecological and obstetric procedures. These were the most important miscellaneous gynecological instruments, but in the next part, we will continue with more advanced instruments, including diagnostic and surgical tools used in obstetric and gynecological procedures.
If you're a medical or nursing student, don't forget to check out the complete Gynae Instruments playlist on MedScope for structured HD visual explanations.